Mayor de Blasio joins me now. Mr. Mayor, thank you very much. I know how busy you are. I can only imagine how busy you are. So thanks for taking this time with us. What are you seeing now in terms of the progress? We're talking about the flattening of the curve. Hospitalizations are down. Do you worry people are so eager to get back out that they may cause this to reignite and, slow down the progress that's been made?
Andrea, that's exactly the concern. What I'm telling New Yorkers is that they actually should be very proud in this incredibly painful crisis. The number of people we've lost, the lives we've lost, now far surpassing what we lost on 9/11, the worst day in our history. It's been horrible, and people have had to go through so much painful change, and our lives feel so different just compared to weeks ago. But New Yorkers, Andrea, I wanted to say from the bottom of my heart, people really have worked at it and struggled and done it. They've done the social distancing. They've done the shelter in place. There's been remarkable compliance with the rules that are in place. I've talked to my police commissioner, Dermot Shea, and he says his officers are out there all over the city, and they're struck by how much people are following the rules. And if anyone makes a mistake and, deviates from the rules, they're being warned, and they actually start complying very quickly. So it's not perfect, but it's been a lot. And that has helped us to see some progress lately. I don't want to overstate it, Andrea. We've seen some improvement on the hospitalizations, but I wouldn't really call it a drop. I would say we've just seen less increase in hospitalizations. Fewer ventilators than what we expected to need are being used. These are good signs, but they're early signs. So you're exactly right. I'm trying to say to people, let's be moved by the fact that people really worked hard, and it's proving that those strategies work. Shelter in place, social distancing, they work, but you cannot let up the gas. You cannot for a moment get ahead of things and sort of count your chickens before they're hatched, or this disease will have a resurgence and we could actually be worse off.
And when you see the economic hardships that flow from this and the medical realities, the disparity in terms of the racial and ethnic disproportionate impact on people of color, this certainly emphasizes that we need to do more long-term, continuing to help people who have chronic health care issues and lack of insurance coverage. But what can you do in this crisis to help those communities from getting the disease, because they then die at a higher proportion than the rest of the population?
That's right, Andrea. And look, when it's all over, we're going to have to really take stock and recognize this country was not prepared, and that the absence of universal health care was particularly damning in this crisis. And if we're really going to address the disparities, and if we're really going to be prepared for the future, we have to have universal health care. That's just abundantly clear now. But what do we do now? What I announced yesterday was a four-point plan to address the disparities in healthcare right now, focusing on our public hospitals, where so many people who are lower income go for their care, strengthening them further. I mean, we spent billions to preserve our public hospital system when it was on the verge of collapse a few years ago. Thank God we did, because now it's been the backbone of saving lives, particularly in the communities that are most afflicted. So it's the public hospitals. It's going out into communities with a huge traditional advertising campaign and digital to explain all the new things we're learning about the best ways for families to handle this disease and protect themselves in many, many languages. It's going door to door. I mean, again, this goes against what we've been thinking in a time of social distancing. But if we can find enough healthcare workers we can spare and give them the PPEs, we actually need to get people out into communities that are lower income, that are immigrant communities, having a direct conversation with people who need to hear from someone really right there in the community, trusted community members especially. And lastly, a very aggressive telemedicine campaign. We think a lot of people, if they could just talk to a doctor or nurse more frequently and have the assurance they could reach someone, they could actually navigate this and be safer and take care of, say, if there's one sick person in the home, know how to isolate them and support them properly. But a lot of people need coaching. They need a doctor or a nurse to talk to. We're going to make that much more widely available.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.